Hi, my name is Genevieve Dunton, and I'm a professor and the chief of the Division of Health Behavior Research at USC. The Division of Health Behavior Research at USC has 27 faculty, and they study a wide range of health behaviors that are related to chronic disease, prevention, and infectious diseases. We have faculty that have training in public health or epidemiology, as well as health psychology and clinical psychology and neuroscience, as well as addiction science. Most of our research then focuses on why people engage in healthy and unhealthy behaviors and how to intervene and change those behaviors. And so some of the behaviors that our faculty study include substance abuse, nicotine use, vaping, cannabis, other types of injection drug use. And we also study a range of behaviors related to physical activity and obesity, as well as diet, eating behaviors, and sleep. And we also have an interest in looking at infectious diseases and behaviors related to engaging in ways to protect ourselves from those infectious diseases. So these include COVID-19 protective behaviors, vaccinations, screenings, as well as HIV and risky sexual behaviors and drug use. And what's really unique about our division is that we have a strong focus on children and youth and young adults. And much of our research targets those populations. And we also focus a lot on health disparities, populations, and concerns in underrepresented minority communities. Some of the things that we may look at to understand why individuals may or may not engage in healthy behaviors include biological factors. So we might look at stress and cortisol and hormones and how those may contribute to our decisions related to our health. We look a lot at stress and our emotions and our mood and our affect. We look at motivational factors and cognitive factors and decision making. And we also look at higher level factors, including social influences from our family, our peers, our friends, society. We look at the influence of policy, and we look at decision making in the policy arena on the design of the built environment and how that shapes our behavior. And lastly, a really unique thing about our division is that we focus a lot on developing innovative methods to understand how to prevent and promote health behaviors. So we do really interesting things involving social network analysis, we do spatial analysis, we do analysis of social media, and we collect data using mobile and wearable sensors, mobile devices, to understand movement and spatial patterns. We conduct a wide range of quantitative analysis with longitudinal growth modeling and structural equation modeling. We have a strong area of qualitative analysis where we're collecting data through interviews and focus groups. And one of our major strengths is in community engaged research and involving the community members through community-based participatory research methods. So what's really exciting about what we do is to see the impact of our research go on and influence policies. For example, we might see that policies regarding e-cigarette use and vaping may be influenced by some of the research that we're doing. And it's also really exciting to hear back from our participants who engage in our studies about the impact it made on their own lives and changing their own health behaviors.